So today I'm going to give you a really quick run through on the paralleling technique. In class we're going to talk about it more in depth, but this is more to get you started in lab so you know how to place correctly and why we're placing it a certain way. So when we do the paralleling technique, you have to use XCPs. They stand for extension cone paralleling. These devices are specifically for this technique. That's why we use them. So you've already learned how to put them together, what colors go where. So today we're going to learn how to use them to be able to line up your PID to take a quality x-ray. So I'm going to show you in the front first. So of course we're going to put our XCP together. Bar goes on the right side. And make sure I can see through my ring. Of course the sensor would be in here if we were actually exposing on a patient. But if I was going to do the centrals on Dexter here, I'm going to place it inside. And I have to have 3 elements parallel. And he's giving me a little bit of trouble here. There we go. Okay, so I have to have the sensor. I have to have the tooth, and I have to have this PID parallel. 3 things have to be parallel for this technique to work. So the sensor behind the teeth, and the PID lining up to the teeth all have to be parallel, which means they run beside each other, never crossing, okay? And it already moved over a little bit. Let's see here. And this is a beautiful example of why sometimes we can't use the paralleling technique in the patient's mouth, because patient anatomy is what makes us have to bisect instead of parallel. So if I had things perfectly, the sensor, the tooth, and my PID right here would be parallel, okay? So from the side you can see everything is running parallel. Now, what happens a lot of times is patient's anatomy, let's say they have tori in the maxilla or the palate, it's gonna cause my sensor to have to be more like this. So as you can see, if we're in the mouth, my sensor's far back like this, the tooth is like this, and my PID is gonna be like this. That's not parallel. So we can't use the paralleling technique in that case. We would have to bisect, which we're learning about later. But a trick you can use to get things parallel is using a cotton roll, especially in the anteriors. So if I open my patient's mouth, place this cotton roll where they bite, I'm able to get a little bit of height and stability. So now my sensor, my tooth, and my PID can all be parallel. That's the goal for the paralleling technique. If you can't get those 3 components parallel, you're gonna have to look at it differently, okay? So let me do a posterior one so you can see how it works there. So let's say I'm setting up for the right side, place my bite block, then my bar, then my ring, and make sure you can see through the ring. So on this side, we're gonna kind of lean it into the patient's mouth and try to get, let's say we're taking a premolar, we're gonna center it on the teeth we want. And at this point, I have to get him to bite a little bit more. Okay, so at that point, our sensor is here, our tooth is here, and I can line my PID up right here, and I can parallel that shot. So it's gonna look like this. And I can move my ring out a little bit so that I can get that. So the sensor, the tooth, and my PID are parallel, okay? Now again, if patient was biting on the sensor like this, Dexter doesn't even want to do it wrong. Okay, so now my sensor's like this, my tooth is like this, that's not parallel. Okay, those are gonna cross at some point. And my PID would be like this. We can't parallel if we don't have all 3 elements parallel to each other, okay? Now, with paralleling, why we like this technique is because we can repeat an image and try to get it exactly how it was before. Because I can take a paralleled image of the centrals and then come back 6 months later and take the same shot and try to compare it more realistically than if we bisect. So paralleling, in like 5 minutes. We'll go over it further in lecture, but I just want to give you a little